Hello, this is Dr. Gay from First Look MRI, and this is a 56-year-old female who complains of swelling and pain along the radial aspect of her wrist. This is the radius. This is her ulna. She does have a little bone erosion here of the distal ulna and some other findings, but her symptoms are really along the radial margin here. She feels a sense of fullness, pain, and tenderness. For several months, she's had no prior injury. And on this view, this is a T1 weighted view where fat is bright and marrow is bright because it has fat in it. And this is one where fat is suppressed. So fluid and inflammation stand out. A little bit of fluid here in this distal radial ulnar joint and a little bone erosion here. But her symptoms are over here and we see the problem. The arrows are pointing to the abductor pollicis longus tendon. It looks normal here in the distal forearm, and as it passes the radius here, it becomes a little bit thick and ill-defined, and lots of fluid and inflammation in the tendon sheath, which is distended. There's also edema in the surrounding soft tissue. So the abductor pollicis longus comes across the radius and attaches here at the base of the thumb. Normally it is nice and well-defined and dark. And I'll show you some examples of other tendons that look normal. So here we have a T1 weighted view. Now the tendon again is indistinct, and this gray tissue or intermediate signal is all the thickened, inflamed tendon sheath, and we call this Quervain Tenosynovitis. I'm going to put up another view here to see the same thing. This is a gradient echo sequence, and we can see that peritendinous inflammation. And now we're going to put up some short axis views. So short axis views are axial images. Here we see the dorsal aspect along the back. This is along the palmar aspect. This is along the ulnar aspect. We see a nice normal extensor carpi ulnaris. We see normal extensor tendons. We see nice normal flexor tendons. They should be uniform, dark. And you can see here how this one's diffusely abnormal. It's lost the normal dark signal. Instead of it's gray, so it's inflamed. And we would call this tendinopathy and tenosynovitis. And again, when it involves this aspect, it is related to Quervain Tenosynovitis. This can be associated with pregnancy and overuse type injuries. It's usually in females between 30 and 50 years old. And it can be associated with inflammatory conditions such as rheumatoid arthritis. And I believe this patient, because of her erosions, may have rheumatoid arthritis, and this may be associated with that. But again, here you can see this severe inflammatory change along the abductor pollicis longus, along the radial aspect. And again, a case of Quervain Tenosynovitis.